Okay, we've got about 25 people on here, so I think let's get started. It's 5:30 sharp. And welcome everybody. Welcome to another installment of MedWave SmartTalks. And today we have the privilege again of welcoming back Dr. Erika Coertzen. She is a leading integrative GP based out of Tzaneen, and she joined the MedWave family in, I think it was July, if I'm not mistaken.
Yeah.
So she's been with us a couple of months, and she's been on a webinar, one of our first webinars. It was such an interesting webinar where she shared some interesting cases, some interesting facts around fascia, and stuff that were new to us. That was really awesome. So we invited her back, and we wanted her to share a little bit more. And tonight she's going to do a very short presentation on chronic pain as well as fascia, and how the photobiomodulation and vibration therapy treats these conditions. And then we've also got Margot. If there's time for her, she can also share a couple of slides. And then, as always, we'll have a Q&A. We've got access to these amazing two health practitioners in Dr. Margot and Dr. Coertzen. So this is your chance. If you've got any questions, please add them in the chat, or you can unmute yourself and ask that question as well. Cool. So I'm going to hand over to you, Dr. Coertzen, to take us away.
Thank you so much. Yeah, I think I'm really passionate about. I'm not a scientist. I must tell you that, but I'm really passionate about what I do, and I think most of the things that I've learned. I've been in integrative medicine now for about 30 years, was really by experience. And I think I've said it before, to just incorporate the things that I really feel that I see the results. So I am really passionate about fascia and pain. And I'm going to share with you just a very short presentation that I've made, a colorful presentation. And I think the idea is that for all of you just to have to understand what I'm going to share with you. Let me just see if I can get this. So now it will be interesting to see if my internet's going to work. Can you see me? Can you hear me?
Yeah.
Okay.
So there we go.
Right. Okay, so I'm going to share with you just some ideas about chronic pain, chronic pain, our sensory systems, how does it work, fascia, and then vibrational therapy and biophotomodulation that I think a lot of the info you need, but I think it's really just to sort of get everything together and tie it together to have a better understanding. So we've got acute pain and chronic pain, and there's a huge difference in the way the body actually responds or how we treat it. So acute pain is that short, sharp, quick pain. It's a graze, a cut, a bump, an injury. It's a sudden injury. So the pain is there to actually tell you that there is damage. And damage means, okay, so be careful, okay? So I want to protect you. The body wants to protect us. And the pain receptors generally is the nociceptors. And when we've got this pain, the nociceptors are stimulated. So there's a really quick message to the brain. So acute pain is easier to treat, and it will respond to symptomatic treatment and with a biophotomodulation to calm down the inflammation and to support the healing. And I think we've had wonderful testimonies, and I think just to see the video that you've just shown now as a teaser, to actually know that when there's an acute injury, it's wonderful actually to treat them with a red light and the biophotomodulation. But then we've got chronic pain, and that's really the more important things that we will see sometimes. It's the more difficult things that we'll have to treat. So chronic pain is a pain that's going to last for longer than 3 months. That's the definition that we say. Then it's a chronic pain. So there's lots of causes, and the causes that we know of is cancer, arthritis, fibromyalgia, any repetitive stress, like a stress fracture and things like that. But interesting enough is the most common type of chronic pain is the one that we actually do not know what the stimulus is. So the patient has got this chronic pain, but we cannot really figure out why it's there. So what happens, the body think and feel that there's tissue damage, but it can't be found. So example is chronic regional pain syndrome. And I'm just going to give you an example. My husband that is a dentist, and he had severe shoulder injuries, which he didn't treat the way he should actually have had. And eventually when he had his shoulder up 2.5 years ago, there was so much damage that, I mean, it was really very difficult to repair. There was actually 5 muscles that were completely, torn, and it was a difficult operation. And then he developed chronic regional pain syndrome. So a lot of the things that I've learned is actually just because I've seen it. And we had to treat that, and it was really very, very difficult. So often it can be one of the reasons is because the acute pain was not managed correctly, but it's not always like that. Sometimes I've realized that the trauma was just so profound that it actually traumatized the body, and the coping mechanisms and of the body was overwhelmed. So what happens then is the pain stimulus gets amplified, and chronic pain actually affects about 20% of the population. So I just want you to understand these two words, or these two statements. There's desensitization and sensitization. So I'm going to explain to you what it is. So we all know we talk about the big 5. That's our senses, and that's taste, hearing, sight, smell, and touch. That's the ones that's well known, and that was, a lot of input was on that previously. But we actually talk now about the additional senses. There's actually 8. So another important one is the proprioception, and that's the body perception and movement. Then it's the equilibrioception, and that's our balance and our vestibular system. But then there's a very important one, it's the interoception, and that's the internal messaging system from the organs to the brain, and that includes our emotions as well. So I just want to tell you again, if the stress response, for instance, kicks in, the body doesn't make a difference between an emotional trauma and a physical trauma. What happens in the body, it's the same organs and systems. So often with interoception, what happens is this internal messaging system, but it also picks them up on all the emotions. So desensitization is reducing a sensory or emotional response to a repeated stimulus. So for instance, when you put on your socks, you feel the pressure and then it fades away and you're no longer aware of the pressure. It takes a few seconds often, so you've eventually felt that it's there, and then for the rest of the day, you're not aware of it. So the brain actually helps us to cut out the noise, to focus on the important things. So we cannot, the brain cannot focus on all the other senses that's there. So it just has to focus on the important things to actually help us, to keep us alive and to protect us. But then sensitization is the important one that I want to talk about. So that is when your body begins to amplify pain to avoid the action as protection against damage. So there's 2 types of sensitization. It's the peripheral and the central. So the peripheral one is at the site of the damage, but the central one involves the brain and the spinal cord. Okay, so chronic pain means there's a reduction in the threshold of the pain receptors, the nociceptors. So it's important to know that then there's a change, there's a reduction in the threshold, and that's often when it begins to become then chronic. So it's really like the volume control button of the radio got stuck on high, and that's the body just experiences it as high. So what then happens is the patient will complain of pain, but it's also it causes fatigue, dizziness, nausea, vomiting, anxiety, depression. So we often see that that's the type of things that people will actually experience. There's really because the pain and that makes them tired, and then they can help all these other symptoms as well. So it's when the brain and the nervous system is stuck in a heightened state, and there's a miscommunication between the signals from the body to the brain. So then what happens is then it's this chronic pain cycle. So what happens, because it's so painful and you actually sometimes experience the pain as worse, then you develop this fear of movement because you don't want to cause any harm, and it's really painful. Then you begin to avoid certain activities. And then sometimes if it continues, it results in social isolation, and you just don't want to do anything. And it can be something that really, really sort of affects your quality of life. And then, I mean, if it's continued for a few months or years, then the depression, anxiety, and fear will kick in. And then sort of sometimes just a small touch or a small input, a small sensory stimulus will actually be experienced as much worse than it is. Okay. So I want to explain to you what is the connection. And to understand this, we need to understand fascia as well. So there are more sensory neurons in the fascia than in all our other senses together. And this is not something that we knew before. I mean, when I studied, and I'm sure when Dr. Marga studied medicine, we didn't really learn, about fascia. So there's a lot of new information, and it's a very important organ. Okay. So, and if we, a new thought is what we say is to addressing any health-related issue without understanding this fascinating system is actually impossible, because fascia plays a role in almost all the organs and systems. So what we know now, the body is not a stack of bricks like we originally believed, but it actually floats in space through something called tensegrity, and that really changes the way we think, which means the body actually, the fascia, is holding us together. The rest of the organs and systems is really just floating. And that's just sort of an idea of how the fascia looks under the electron microscope. So it's an incredibly interesting, fascinating system that we're learning more and more about continuously. So fascia is really like the missing link to human health and well-being. So it's a complex, continuous web. It's the connective tissue that runs throughout the whole body without interruption. So the fascia is one, and it runs in certain directions. So we call it anatomy train. So it's really fascinating to understand this. So it's the fascia that gives us structure and stability and facilitates movement. So if we understand that there's more sensory neurons in the fascia, then we will understand why it's so important to treat the fascia if we treat pain and if we look at chronic pain. So what does fascia do? There's a lot of things that I do, but I'm just going to sort of highlight a few things. It's part of the nourishment of the body, so it helps with the fluid and mineral exchange and vitamins. So it also facilitates elimination of toxins through the lymphatic system. It facilitates neurological communication. So over 80% of nerve endings are to be found in the fascia. So it's really, really a place, like you can see, a very important role. So these receptors play a key role in the pain that we experience. And these receptors are closely connected to the autonomic nervous system. So there's a direct communication from the fascia and the nerves and the sensory neurons to the autonomic nervous system. So the fascia consists of about 80% water. So we've also, we sort of know that the body is mostly water, but we understand now that the fascia is mostly, it's 80% water. So that's also why it's so important if we work with patients with chronic pain, that hydration and water and fluids are so important. So then damaged fascia forms sort of myofibroblasts that causes stiffness, inflammation, and pain. That's the type of things that we know, but it's actually not the muscle, it's the fascia. So let's look at fascia and vibrational therapy. Okay. So the oscillating movement of vibrational therapy can break adhesions that causes this stiffness, because when there's scar tissue, it's almost like it blocks also the communication in the body, because the fascia is such an important part of communication. So vibrational therapy improves hydration and the lymphatic flow. It enhances the bioelectric conductivity. It reduces the pain, and vibrations in fascia is faster than the nerve conduction. Okay. So just that picture, it's my 3-year-old grandchild. He loved it. They love standing on the vibration plate. But if we look at further at vibrational therapy and healing, so it stimulates healing. That's things that we've known for a long time. So there's lots of ways that we use it. Physiotherapists actually know it. There's a right resonator. So there's lots of vibrational therapies that are used. Okay. And what it also does, it increases mobility, it increases motion, it can increase bone density, it reduces pain, it helps us with coordination, it helps us with relaxation, and it promotes growth of muscle fibers. It increases the nerve regeneration, and then obviously also it's part of weight loss. So just to understand that the fascia plays a huge role in vibrational therapy, has a great impact on it. And part of it is also because you can just think about the fact, vibrations in water, it's a huge impact. So then if we just look at the effect of biophotomodulation on pain, and this is things that Dr. Marco can explain much better than I can, but if we think about what happens, it's the light absorptions. So the photons from the light source are absorbed by the photoreceptors in the cells. And then we've got the cellular response. So the absorption triggers a cascade of events. And a very important part is the increased production of ATP, that is our cellular energy. And the ATP plays a very important role in the stress response as well. So I'll explain that a little bit about that later. So then there's also the modulation of reactive oxygen species and altered intracellular calcium. So these are really important things also in the pain response. And then also nitric oxide is released, and there's vasodilation, which means that healing can take place. So everything supports just the fact that it works proactively on healing and pain reduction and the inflammatory response. So then the therapeutic effect is the cells increase and they can differentiate. There's tissue repair, inflammation relief, and then there's pain relief. So just the light in itself, the biophotomodulation has got a huge impact. And I think if there's somebody that sometimes we see patients with like an acute injury, so they cannot necessarily go onto the vibration plate, but just the red light will already make a huge difference. Okay. So I just want to explain to you, I also do a lot of TRE, it stands for tension and trauma releasing exercises, but that's something different. But that gave me a lot of understanding about the connection of a muscle tremor, or a muscle and a fascia tremor and the autonomic nervous system. So I'm just going to sort of give you an idea of how shaking is a regulation. So to understand this, and I think this is we've actually got three brains. So we talk about the triune brain theory, and all three of them can function by itself. But the best way is for the three of them to be connected and function as a balance. But the first one, the brown one, is the neocortex, and that's our human brain. So that's our rational thinking, our creative, cosmic, spiritual belief systems, imagination, all the wonderful things that actually makes us human. But that only controls 5% of everything that happens and all of the functions that's in the body. Then we've got the limbic system, that's also our mammalian brain, and our brain stem, that's the reptilian brain. So the limbic system is part of our emotional reactions. The fight and flight response is also it's part of the fight and flight response, and the basic emotions that we'll have with any stress or trauma of fear, anger, hate, hurt, and rage. But then very important is the brain stem, which is our most primitive brain. It's also our reptilian brain. And that's where our instincts, our respiration, our heart rate, our blood pressure, and everything comes from. And there's a connection I'm going to explain to you now from the brain stem to the muscle. So the limbic system and the brain stem is actually our survival brain, and that controls 95%. So the autonomic nervous system is connected to that, and it's a very fast computer versus the human brain neocortex that's actually a very slow computer. So I understand the connection between a vibration and a muscle and a fascia and the link with a brain stem, and I'm going to explain to you how it works. So there's a direct link from skeletal muscle and fascia to the brain stem to activate the fight and flight response. So there's even a faster response from the brain stem via the nerve to the muscle than adrenaline could actually. Adrenaline comes later because we have to it's the muscle that actually have to help us to survive. So it's important to know, and we understand this because there was lots and lots of studies done in animals, So we do know that animals in the wild don't get any disease. They, I'm close to Kruger Park. Animals in the wild don't get cancer and arthritis and diabetes and heart disease, but animals in captivity and pets get the same diseases we do. The connection is the muscle tremor to that link from the muscle tremor to the brain stem. So think about animals in the wild. They constantly still have this muscle movement, this muscle tremor. And that is actually the link, because that deactivates the stress response. So if, for instance, in animals in the wild, and we know if they dart them, and I've got lots of videos of rhinos and things, if they don't have a tremor response after the darting, they'll actually die. They go into the freeze response. So that's a very important connection to understand, that how important a muscle tremor, a fascia tremor, and a vibration is for us and for our health, and that link to the autonomic nervous system. So, like I said, the ATP, like I said, the biophotomodulation, the red light, stimulates that, but it's so important for the muscle and what happens then in the muscle, because the muscles have to be ready for us to survive. So it's that constant readiness, and that we need that ATP in the cells, in the mitochondria. So just to then repeat again, there has to be a muscle vibration or a tremor to send a signal to the brainstem to deactivate the stress response. So that's why a vibration then will help in two ways. The one will be just the fact that our vibration stimulates healing. But the other part of our vibration is it sends a signal to the brainstem, and that immediately helps the body to calm down, and the stress response are deactivated. So the muscle vibration or the fascia vibration sends a message to the brainstem to deactivate the fight and the flight response. And that's what will happen then. The vibration plate will activate the signal from the muscle and the fascia to the brainstem to stop producing the stress hormones, and the autonomic nervous system will calm down. And so when the nervous system calms down, the body goes into rest and restore mode, and that's our optimal state. So if the nervous system can then be in that, we call it the ventral vagal state, that's the vagus nerve in the rest and restore mode, and that's when we are healthy, and then we experience our environment is safe, and everything in our body just functions much, much better. So that in that way, if we continue to actually stimulate that biophotomodulation with a vibration plate, it will help to desensitize the pain pathways. It might take some time. Generally, we'll say we need sometimes a 3-month period if it's something that's really chronic. But yeah, that's just what I wanted you to understand, the different mechanisms and how pain can be treated with the vibration therapy and biophotomodulation. And yeah, that's my story.
Thank you, Dr. Coertzen. That's fascinating. Yeah, that's really interesting. And it's, over here, the vibration therapy is kind of the supporting act, but more and more it's coming to the forefront with all the benefits that it has. So maybe before we get to Dr. Margot, I don't know if you could share some interesting cases that you've had in your practice, with treating with the photobiomodulation and the vibration therapy. I don't know if there's 1 or 2 cases that you can maybe share with us that's interesting.
Well, I think I'll share it again, because I think people, there were people that hasn't heard it before. But I think one of my patients has had chronic pain for years and years, in the sense that she couldn't sleep. So she actually had a TENS machine on her body, strapped. That's the way she slept with it. It was on her every day, the whole time. And so when she came to me, she was really that depression, fatigue, and, just like, and life's not worth living. She even had her breast implants removed because she thought, that could have been part of just scar tissue and that, but it didn't work. And so from the start, she just responded so well. I treated her with just natural remedies, so it's more pro-inflammatory medication like injections and that. And I think she is just pain-free. she doesn't, and she still, she just believes in going to the, continue. I think she's already probably had about 20 sessions or more, and she just wants to know if she goes on holiday and they're going to Plettenberg Bay, where she can, just have a MedWave there, somebody. The other one is, I think, my husband. I think after his shoulder and the chronic regional pain syndrome, he developed a lower back sciatic pain. Debilitating. It was about for 18 months and he's a dentist. So it was for him excruciating. He cannot sit. If he travels, because he's got a clinic in Polokwane as well, it was really and it really affected him. And when he stood on the vibration plate the first time, I witnessed him. That was one of the things that fascinated me. He stood on it, he changed his position, and he had an interesting way of standing. And I just want to tell you, you've seen physiotherapists, had acupuncture, everything. And we've really done everything. And immediately he said something happened. And I realized that vibration, it really just probably helped with the fascia and scar tissue. At this stage, he is 95% better. Swimmers. There's a lot of people, obviously it's there's a lot of swimming competitions. So to work with them and just support them. So one of my patients, she's in her 40s, actually, during the World Championship now, I think she was number 5. Yeah, she came 5th. And she definitely says, I think it made a huge difference for her. Just the MedWave. So those are just interesting cases, but I think I've just seen so many people that it's almost like they get their life back. That's why I'm passionate about it.
That's amazing. Yeah, at our office here we've got 2 vibration plates that's installed, and it's often most of the time it's occupied with either people that's working there or clients coming for treatment. So yeah, it's really an awesome piece of therapy. So Dr. Marga, I don't know if we can segue to you, and if you've got some interesting slides that you can share with us.
Thanks, Francois. Thanks, Erika. I think Erika, you did you condensed an encyclopedia into half an hour because it was so rich with information. And I think what also stands out for me from your talk is just, to realize that stress link and to understand that the brain and the muscle are speaking a very similar language. And so what is going on in the brain, literally is being imprinted in your body. The mind-body connection means that everything is connected. And so I think that also comes very much back to just trying to see our human body as an integrated system, and it really is an information system. And we think of our connective tissue that is literally, I liked your explanation of basically we're floating, our body's kind of floating together because of our connective tissue. It's literally suspending everything, and to realize that it's not just suspending our muscles, it's our blood vessels, it's nerves, it's literally everything. And one of the things that is also really important to consider is that the fascia is rich with cells that are doing very important things. So I'm going to share my screen and just chat a little bit more about really how, I always come to everything from the perspective of the mitochondria. But just to add a couple of thoughts from my side, so I'm just going to quickly pop a little share there and see how we go, and just get on to this presentation quickly. Here we go. So just always coming back to my favorite thing, which is mitochondria, and really, when it comes to our mitochondrial function, so critical for everything that happens in our cells is literally the hydration aspect, and that is an aspect that is important from our fascia as well. And reminding ourselves once more that one of the targets for our photobiomodulation is that cytochrome C oxidase, and that speeding everything nicely along the electron transport chain. But at that point, just before we start to make ATP and do all these important things, here at complex 4, we get the production of something called metabolic water. And that water is a source of hydration for our mitochondria in the mitochondrial matrix. And it's a very special water. It's called what we call structured water. So it has this capacity to act as almost like a crystalline structure, and it's extremely competent in conducting electricity and signaling. And this metabolic water is most important because it also is, when there's enough of it, adding to the general tissue hydration. So our mitochondria within our connective tissue, and our connective tissue is not just sinew like we think of it when you're eating some meat and you get a sinew, you kind of like, that's connective tissue. But actually, that connective tissue is rich in cells, and it also needs to be appropriately hydrated. And the mitochondria within our connective tissue are producing much of the hydration for the connective tissue, and allowing connective tissue to being fully hydrated, become literally an information highway, so to speak. And there's a number of reasons why we want our connective tissue to be hydrated, and this is definitely the strong point of our mitochondrial function, providing that hydration within the mitochondria, but also that hydration to the tissue that mitochondria is servicing, is that it's really decreasing amount of friction. It's actually stimulating cells to lay down more collagen, and it's really making sure that we're not having adhesions between those very, very important layers of tissue. So just something to think about, and that's another fantastic benefit of the photobiomodulation. And the other thing is that although we think of our structures and our mitochondria cells being targets for photobiomodulation, I just want to point out something in terms of our response to light. It's a photochemical response, it's a photothermal response, it's a photoelectric response, photofluorescent, but also photomechanical, and also photomagnetic. And that mechanical aspect that Dr. Coertzen spoke about earlier, that you're getting from the vibration plate, it's a very important signal for our cells and for our tissues. And just a reminder, we often show this slide when we're talking about wound healing, where we're talking about an actual injury. And of course, the first thing we need to sort out when there's an injury is we need to stop bleeding. But if we look at a soft tissue injury, we might not have the bleeding, so we don't need to worry about the hemostasis or the clotting of the blood, but it might be at a microscopic level. But in a soft tissue injury, we're still getting damage to cells. We're needing an inflammatory response to remove the debris and to clean up that area. We do need new cells to grow, which is the proliferation, and the finishing off, which is the remodeling in the extracellular tissue, the remodeling, getting that area back to its normal collagen-rich state. And so remembering that in our fascia, we've got immune cells. We actually have some protective fat cells in the fascia to give it a little bit of kind of, shall we say, sort of softness. Fat is a very good insulator. It's a very good shock absorber. And then we've got our own fibroblasts, just like we have fibroblasts in the skin. So we see them, they're important for skin maintenance, but we've got those in our fascia as well. So they're all important in healing tissue when we do get not necessarily a wound that's bleeding, but an actual structural, maybe just a bump or a bruise, or in stressed fascia that is dehydrated and that actually is not able to manage itself well, and we get upsets in terms of the integrity of that fascia. And once again, just a nice reminder about what our beautiful red light photons are doing in the skin, but they go deeper than the skin into our stimulation of fibroblasts and then into synthesis of our connective tissue. That's important for the aesthetics of our skin, but at a structural level, much of this signaling is also down to impacting the integrity of our connective tissue. And just an interesting one coming into the pain discussion is that if we take these fibroblasts, which are involved in tissue injury, and we look at, this is a cell experiment, you see the same impact with red light as you would see with a non-steroidal anti-inflammatory. We see a reduction in the signaling of prostaglandins and your COX enzymes and your TNF, which are all mediators of inflammation and pain. So red light can work as well as a painkiller in terms of some of its action that we've identified at a cellular level. So it's why we feel better when we're in the sun, why we feel better when we're having those wavelengths of light, and also that little bit of heat. So many factors that are at play here. And I loved, Erika, that you also mentioned the nitric oxide, because it's one of the benefits that we get when we're looking at the full body delivery of the photobiomodulation, is that we're activating this nitric oxide reservoir in the skin. So where before it was thought that nitric oxide could only be liberated with ultraviolet, some of the UV wavelengths, we now discovered that actually red and your near infrared are also activating the nitric oxide reservoir in the skin. And so that is getting more blood to areas that need to go. It's essentially regulating nerve transmission, pain and sensory feedback, and doing a couple of very important functions in terms of metabolism, also helping us to mop up some of the free radicals, to decrease inflammation and immune system tone. So that's another important area that we want to focus on. And as we've mentioned, this incredibly important additional benefit when we bring the whole body vibration in. We're not just working on the muscles, as Erika pointed out. We're actually working on the whole nervous system. We're working on the brain, from the synapses right through to the neurons and through the peripheral nervous system. And of course, that has an important, very important role to play in pain perception, pain intensity. So once again, we think of the combination of the whole body vibration as being mostly for fat loss or exercise stimulation or simulation, and we pair it with the photobiomodulation for metabolic fat loss, but actually it has an incredible benefit in terms of pain. So I just wanted to share some of those slides with you. And perhaps what we can do is take some questions and so just take our conversation further.
Great. Thanks, Dr. Marco. Yeah. So yeah, we've got a couple of minutes left here. That was also really fascinating. So please take this opportunity to ask questions while we have access to Dr. Margo and Erika. There's 2 questions in the chat. Margo, I don't know if you want to...
Yeah, I can see those. So a question around if the brainstem is moved because of a prior pituitary adenoma. That person is now currently experiencing some functional neurological disorders. Would it be fine to continue with photobiomodulation? So certainly photobiomodulation, there are practically no absolute contraindications. And it can only do, it can only be of benefit for many, many reasons, if nothing else, to assist in sort of stabilizing mitochondrial function, intracellular hydration, and possibly modulating some of the neurological feedback. Remember, our nervous system and our neurons, have got a lot of mitochondria in them. The other thing is that those mitochondria are involved in obviously all the jobs and work that the nerves do, but they're also involved in the insulation and the myelinization in the nervous system. And so the benefit of photobiomodulation is that we can actually get a remyelinization and a more, what you would say, robust myelinization. And of course, when your nerves are more myelinated, you get better conduction of those nerve signals. So from a brain stabilization and a brain health perspective, incredibly important. And another thing that Erika, you were chatting about, that sort of brain muscle connection. Exercise is almost like a nutrient for the brain, because as we are moving our muscles, we're releasing a number of what we call neurotropic factors, and an important one is brain-derived neurotropic factor, which actually stabilizes the brain. It prevents neurodegeneration. It promotes neuroplasticity. So incredibly important. I see Dr. Lascari is nodding there. Welcome to the family. And the other question is, would photobiomodulation help a patient who had a transient ischemic attack? So there's been a reasonable amount of good research that has been focused on stroke and TIAs. For so many reasons, I would say yes to that, obviously without knowing all the clinical details. But we're looking from the perspective of revascularization, from better circulation, to just decreasing that neuroinflammatory assault that comes with the TIA. And Erika, I don't know if you want to add some things to that. I'm sure you've got some additional ideas there too. Anything you want to throw in, jump in.
No, I agree 100%. I think one of the things that I sometimes use extra is actually to use music. For awesome. Music and that, yeah. And I was thinking that I'd like to try it actually, get headphones that we can use and see, because there's a lot of research on that as well, the effect of the brain and on Alzheimer's and things like that. So I think that might just be something that we can explore.
Yeah, I think it's incredible. I read a paper just now. There was one or two papers that came out that actually looked at individuals under the photobiomodulation panels and having photobiomodulation treatment, and then practicing mindfulness exercises, and how and of course they were linked up to neurofeedback, and how the photobiomodulation was actually complementing the mindfulness practices and the way that was changing the brain. So very, very interesting. And I'm quite sure the music is going to do some interesting stuff. Mm-hmm. Yeah.
Perhaps that's a new product in the pipeline. Right, we've got two more hands up. Lindy, you're welcome to unmute and ask your question.
Well, I've got one question for each of you. Maybe start with you, Erika. I've done TRE as well. And I was wondering what sort of frequency or speed are you doing on the vibration machine to trigger a TRE response?
I just think that almost, I want to say, all the frequencies. If there's a vibration, it will have an effect, because even with TRE, there's sometimes very fine vibration, sometimes there's more stretches, So I think I haven't researched, or, basically, but I'd say that a basic, I want to say 20 to 25 hertz will probably have a great result. But I think the patient will actually tell you, because every person has got sort of a almost like in a frequency that they feel, this makes me feel good. So, and it can also change. So just my thoughts on that.
And then Dr. Margot, in terms of weight loss, what are you using?
So I'll be politically incorrect. I use sunlight, but red light is awesome as well. So I think with weight loss, I actually only use the contour machine. I only use the red light, and I know the vibration plate is a fantastic added extra. From my perspective, I focus a lot on circadian biology and getting the light environment and timing to basically then set up metabolism for the day and get all the metabolic clocks in order. And the red light is like it seals the deal. So because of its effect on the mitochondrial tissue, mitochondria in the adipose tissue, and the general impact on glucose sensitivity. So if you're using the vibration plate, you again, as Erika said, individuals come to you with they have a level of muscle tension, they have a level of mitochondrial muscle health, they have a level of fascial stress, and so different doses feel better for them. It can sometimes be too much. Sometimes you start and you're over-conservative. So very much as Erika said, listen to what your client is saying. Pay attention to them saying this is too much, or I feel I can do a little bit more. Watch out for the ones who want to do everything on high speed. But again, the combination of that vibration plate and the photobiomodulation is perfect because of what you're stimulating, how you're activating multiple systems with that. So I use just the photobiomodulation device, and I use a lot of other little sort of like lifestyle hacks in terms of circadian and sunlight. I did want to say something else about your first question. Yeah, it was around just that the fact that people that Erika answered about people being quite unique. So also remember that different people present to you with a mitochondrial electron transport chain that is more or less susceptible to making too much oxidative stress. And that's a genetic thing. Some people make a lot of oxidative stress in response to the photobiomodulation, and some make less. So they all come to you with different levels of mitochondrial resilience. And that's why we do, after a while, if we listen to our patients carefully, we often adjust doses slightly for them. The panel goes a bit higher because they're getting hotter a lot faster. The sessions are maybe shortened a little bit because, again, they overheat. That tells us a lot about how their mitochondria are uncoupling and going into a little bit of an adaptive response, which is not bad, but it just might be a little bit more unpleasant for the person to be sweating under the lights.
Thanks. Thank you.
Cool.
Right. Sadiqa, go for it.
Yeah.
Hi, everybody. So I just have a quick question. It's very interesting to see how the photobiomodulation has such a huge impact on the overall well-being of patients. But as integrative doctor, we're often very mindful around integrating tools into the treatment plan of patients. And I actually wanted to inquire about patients with eye disease. I know that we've got the little goggles that we place over the eyes, and the mitochondria is quite saturated in the eyes as well. And I noticed when I use the red light that I could still actually feel the heat or the redness coming through, which didn't bother me at all. But I've got two patients that I would like to consider, and I thought I just wanted to check if that's fine. I know that you said there's no absolute contraindications. So the one individual is a patient with rheumatoid arthritis, metabolic syndrome, which I think personally she could do really well and could actually come off some of the medication if you put her onto the, under the red light and on the vibration plate. But she recently has been diagnosed in October with right retinal eye venous occlusion. And she had quite a workup done at hospital where they couldn't really find any root cause, so they labeled it as idiopathic. Would this be safe to consider with that history? She's still seeing the ophthalmologist. And then I've got another individual, actually two patients that do suffer with glaucoma. The reason why I'm posing this question, I was told that when my machine got set up, that the vibration plate, went through the whole process of how to utilize it. And caution was suggested with patients that might have eye disease to watch out that it could potentially not cause, but retinal detachment can occur. So just because of that, I thought I just want to check in these type of clinical pictures, whether it would be relevant or not.
Yeah. I think, we want to be cautious with someone with a history of retinal detachment, and it's just is being overcautious. But with the other two conditions that you're talking about, certainly with the glaucoma, there's quite an interesting discussion about actually using different wavelengths of light for glaucoma. With the venous issue, there shouldn't be a contraindication, and people have got differing degrees of light sensitivity. So sometimes a little face cloth over those goggles makes someone feel a lot more comfortable. So again, listen to what your clients are saying. If they say, my eyes it's too much, pop another layer of little white face cloth over there. But no absolute contraindications for the two conditions that you mentioned. So that's all good.
That's what's going to be cool. So, dear guys, we have two mini documentaries coming out, and in those documentaries, there's two patients in there who's giving testimonials, and one of them has got rheumatoid arthritis that was treated by, I think Jessica might be on this call, and her words was actually, thank you for giving my life back for that condition. And the second one was treated by Dr. Ben Coetzee in Paarl, and that patient had macular degeneration, and she's had incredible results. So look out for that. It's going to be really cool to witness some of those testimonials. Right, guys, we are almost getting to the end. I know there's a couple more questions. Margot, I don't know if you want to fly through these quickly.
Sure,
and then,
So there's a question about a Baker's cyst. So that's often a fluid something, often behind the knees. I hope that's the Baker's cyst that everyone is referring to. But again, when there's a cyst, we're often thinking inflammation. So could it treat it? I'm not sure. Could it be helpful with just that unnecessary fluid accumulation, etc.? It wouldn't do any harm. I wouldn't see it as a treatment. Parkinson's and dementia, there's lots of research in the neurological space because of the impact of the photobiomodulation on a host of neurological parameters, from your remyelination to just brain connectivity, to decreasing neuroinflammation, to actually assisting with your sort of synaptic timing. So lots of research in that space, and the research is it's being delivered, or shall we say it's being presented as a very conservative in a very conservative way. But practically on the ground, some Parkinson's patients have had remarkable benefits in better quality of speech, in less trouble in terms of movement. And then I think chronic fasciitis, what's your take on that, Erika? Anything you want to add to that?
No, I'd say it's probably one of the best things that you can treat it with, but I'd say slowly. Really work with the patient's threshold, and definitely start slower. But I feel it will make a huge difference. And I mean, obviously the combination, I think the vibration plate and the light, the biophotomodulation. Yeah. And
Sure,
it can be 3 months before you really sometimes see a shift.
Okay, I think that's important, and I think you mentioned it before, is just, chronic conditions need to unravel. There's a lot of signaling that has to be restored and brought back into balance. Arabang, a question about, is photobiomodulation safe for patients who've had laser lens replacement for cataracts? Yes, there's no problem there, but you do the general eye protection. And again, just watch out for sensitivity. Our LED panels are very bright. It's not the wavelength of light that is an issue. It's just that it's incredibly bright. And sometimes that's just an overstimulation. Our retina has got the most mitochondria of any other structure in the human body. And so you don't want to blast these things out the water. So hence some eye protection is needed. And the protocols for the eyes are very conservative. But we know the story of so many people whose eyes seem to improve just as a side effect. But no problem with individuals who've had lens, etc., for cataracts.
Awesome, everybody. Thank you, Dr. Margot, Dr. Coertzen. This was packed with so much information, and really fascinating, and the insight that both of you shared. It's incredible. So thank you for both of your time. We really appreciate it. If anyone on this call needs any more information on any of the products that we're selling, or need information on conditions, treatment, or the science, please reach out to us if you've been in contact with any of our team members, or you can just send me an email at franscha@medwavegroup.com. You're more than welcome to send a message through to us at any time. So for now, we're going to say goodbye, and we're going to catch you on the next MedWave Smart Talks. Thanks, guys.
Thanks,
everyone.
Bye-bye.
Bye.